some more absolutely devastating news to come out of the coronavirus pandemic. A hero doctor, James Mahoney, 62 years old, died of coronavirus. He delayed his retirement when the COVID-19 pandemic hit, and he has now passed away from COVID-19. Instead of going forward with his plans of retirement, he charged onto the front lines and led the intensive care units at Kings County Hospital and SUNY downstate. Kings County Hospital is in Crown Heights, Brooklyn, deeper into Brooklyn, a poorer area, and that's where he worked. SUNY is the leg of that hospital, and instead of taking what seems like a much well-deserved retirement, he chose to stay and help, and it took his life. As the coronavirus pandemic took hold in New York, Mahoney worked nonstop at the underfunded institution that serves a predominantly poor Black community, the New York Times reported. The doctor was Black himself. Many physicians near his age stopped seeing patients out of concern that age or health issues would put them at greater risk, but Mahoney refused to leave, according to his brother, Dr. Melvin Mahoney, who told the Times. He worked on the front lines to the end. Mahoney, who was on the front lines during the September 11th terrorist attacks and the AIDS epidemic, never hesitated to care for patients, according to his boss, Dr. Robert F. Ferrangi. Now, I think it's just incredible to see these doctors specifically putting themselves in harm's way for their communities, for poorer communities, and especially when they don't have to. Dr. Mahoney worked to fight the AIDS epidemic. He worked to help people hurt by the 9/11 terrorist attacks, bodies, death, destruction. He'd done his time, but he chose to keep healing people, even at great risk to himself because he was older. There were people who were really reluctant to go into the rooms, and you can understand why. Ferrangi told the Times. He saw another human being in need and didn't hesitate to help. He was known as a giant in the field of medicine, but also a gentleman who treated the janitors as well as he treated the CEOs, CBS New York reported. You also hear stories of doctors of that age, an older age group, who chose not to treat coronavirus patients and instead do other work, which is completely understandable because they were at risk. Dr. James Mahoney didn't do that. He chose instead to delay his retirement. On Rebel HQ, I also talked about Dr. Lorna M. Breen, who died by suicide after treating coronavirus patients and getting coronavirus herself. Her father says that she was just so devastated by all of the death that she saw and her inability to help, the lack of protective equipment, the lack of ventilators, the lack of necessary resources needed to help people. And she's just one of the many, and Dr. Mahoney is just one of the many heroes who lost their lives due to inaction by our government, not providing the resources that they needed, and due to this extremely devastating time that we're all experiencing now. So as people cry about reopening the economy and claim that that's what we need to be doing, that needs to be our number one focus, remember all the healthcare workers who sacrificed themselves, their lives, their family safety to save people, and how there could be more of them if we're unable to curb the pandemic because we care too much about rich people's stock portfolios and temporary economic gains.